Section 1. Key Issues in Aged Care. The Learner Guide identifies three major issues in aged care. 1. Funding. Inadequate funding affects the quality of care and the ability to meet rising demand. Funding constraints. Providing quality care can get expensive. Many government and non-government funded providers lack the resources to improve their services. 2. Workforce. Lack of skilled workforce shortage. There are difficulties in recruiting and retaining staff. 3. Treatment of older people. Some older people report unmet needs. Some experience abuse or neglect. These issues affect the quality, safety, and consistency of care. Understanding them helps workers make better decisions and adjust expectations in their role. Simulation 1. Impact of workforce shortage. Rushing care.
I feel rushed and ignored.
I'm sorry. I'll slow down and focus on what matters to you.
Even when resources are limited, respectful and person-centered care must remain a priority. Section 2. What is psychosocial disability? Psychosocial disability refers to the impact of mental illness on a person's ability to participate in everyday life. Older people with psychosocial disability may struggle to concentrate, cope with time pressure, complete tasks, interact with others, manage stress, accept constructive feedback. As an aged care worker, you may see clients withdraw, isolate themselves, or struggle to communicate their needs. Section 3. Psychosocial disability versus mental health. Mental health refers to emotional, psychological, and social well-being. Psychosocial disability is not a diagnosis. It describes the functional impact and barriers a person experiences due to a mental health condition. Important to remember, not all older people with mental illness have psychosocial disability. Psychosocial disability varies between individuals. Past trauma, stigma, or discrimination may worsen its impact. Workers must be patient, sensitive, and supportive. Simulation 2. Communication challenges. Struggling to engage.
I don't want to talk today.
That's okay. I'm here when you're ready.
This respects the person's emotional state and avoids pressure. Section 4. Impacts of psychosocial disability. Psychosocial disability can restrict an older person's ability to understand feedback, manage multiple tasks, interact socially. Workers should use reassurance instead of criticism, observe nonverbal cues, break tasks into simple steps, allow extra time and flexibility. Section 5. Episodic nature of psychosocial disability. Psychosocial disability is often episodic. This means a person may cope well one day and struggle significantly the next. Support needs can change in intensity, duration, and impact. Workers must adapt their approach day by day. Individual plan benefits the person receiving care via ensure that the care provided is aligned with the unique needs, preferences, and personal goals of each client, facilitating a more effective and person-centered approach to care. Ensure they receive required medication. Ensures consistent care. Assist with communication and record of the person's goals and progress. Serves as an agreement between the person and the care provider. Simulation 3. Responding to an episode. Today is different.
I notice today feels harder. Would you like extra support or some quiet time?
This flexible approach supports dignity and safety. The episodic nature of psychosocial disability and the variation in supports that may be required during different periods. Explain how the needs of a person with psychosocial disability can vary significantly over time due to the episodic nature of their condition, requiring flexible and adaptable support systems to ensure continuity of care and effective management of the disability. Episodic means not constant and changing every day. This means that an older person is fine one day and then they would suddenly not want to interact at all the next day. It can also vary in intensity, duration, and impact on the person. Section 6. Additional and alternate support services. When psychosocial disability affects safety or well-being, additional support may be required. Additional support services, general practitioners, and specialist doctors, mental health practitioners, occupational therapists, alternate support services, National Disability Insurance Scheme, NDIS, Disability Support for Older Australians, DSOA, My Aged Care. These services focus on recovery, independence, and social inclusion, not curing the disability. Simulation 4. Escalating for support, seeking additional help.
I've noticed ongoing withdrawal and distress. I think additional support services are needed.
Workers must report concerns and seek appropriate supports when needed. Section 7. Interaction with other disabilities. Psychosocial disability can worsen. Dementia symptoms, anxiety or depression, behavioral changes. Workers must adjust communication methods and inform supervisors if the client's condition worsens or does not improve. Section 8. Assessment focused. Summary: for assessment purposes, remember, aged care faces funding, workforce, and treatment challenges. Psychosocial disability affects daily functioning, not diagnosis. It is episodic and varies in intensity. Older people may need additional or alternate supports. Workers must be observant, patient, and report concerns promptly. Key issues in aged care include funding limitations, workforce shortages, and the treatment of older people. Psychosocial disability refers to the functional impact of mental illness on an older person's daily life. It is often episodic and may require additional or alternate support services. Aged care workers must provide patient, respectful support and report concerns to supervisors. Understanding the issues facing aged care and the experiences of older people with psychosocial disability helps you deliver safer, more compassionate care. Thank you for watching.